Good afternoon, everyone. My topic of discussion is comparison of safety and efficacy of active sentry and ozil handpiece for Centurion Vision System. None of the authors have financial interest to disclose. Traditional gravity-based fluid has been standard of treatment for decades, but anterior chamber tends to fluctuate after post-occlusion brake surge response. Centurion Vision System equipped with active fluidics designed to maintain target IOP to overcome the problem associated with variable infusion and aspiration rates. It compresses bag of BSS to overcome infusion line resistance and thus maintain the anterior chamber at low IOP and stable chamber also. Active sentry handpiece is equipped with fluidics pressure sensors. It senses changes in irrigation at the handpiece level and eliminating the delay in adjusting the fluidics. It also automatically detects patient's eye level. It is a prospective observational study. It is a prospective randomized comparative study in which 204 eyes of 204 patients were included. It was divided into two groups. 101 eyes underwent phacoemulsification using ozil handpiece, and second group, 103 eyes, operated using active sentry handpiece. All uncomplicated cases done under topical anesthesia were included in this study. All complex cases and combined cases operated under local anesthesia like subtenon, retrobulbar or peribulbar were excluded from this study. Complete preoperative evaluation was done for all patients. All surgeries were performed by 5 experienced surgeons of more than 1,000 phacoemulsification surgery. Patient eye level was set at -5 in ozil handpiece and it was automatically adjusted in active sentry handpiece. All the parameters were almost same in both handpiece group, except significantly lower IOP was set for active sentry handpiece. Parameters evaluated were patient's comfort level, where 0 was identified as no pain, 1 mild pain, 2 moderate pain, and 3 severe pain. Surgeon's comfort levels were subjectively assessed. 1 cannot proceed, 2 not comfortable, 3 comfortable, and 4 very comfortable. Other parameters were amount of fluid use, cumulative dissipated energy, number of times activation of active surge mitigation. So active surge mitigation works by partially venting the aspiration line, thereby reducing the vacuum demand from the anterior chamber. It detects occlusion brake instantaneously and signals the quick valve technology to release fluid into aspiration tubing, just to prevent the surge. So ASM was activated in 51.5% of eye, of which 79% was in soft cataract and 20% in harder cataract. In 64% patient, it was activated for more than 3 times, and in 35% it was activated for less than 3 times. For comparison between the active sentry and ozil handpiece, moderate patient comfort level, moderate pain was encountered in around 30% of patient while operating in harder cataract using ozil handpiece, whereas only 14% was patient complain of moderate pain with active sentry handpiece. And surgeons were not comfortable in 30% of patient for harder cataract using active sentry handpiece. But it was statistically insignificant. Coming to discussion, similar comfort level of patients were observed in more than 60% of patients. Surgeons were more comfortable using ozil handpiece while emulsifying harder cataract, but active sentry was a better surge protection under lower IOP, operating under lower IOP. Greater number of patients with harder cataract experienced pain in ozil handpiece, no significant difference in CD levels between two groups. Limitation, we were unable to compare endothelial cell loss. Conclusion, to conclude, active sentry technology was safer and equally efficacious as ozil handpiece in Centurion Vision System with added benefit of operating under lower IOP. This is my reference. Thank you.
So how this technology is different from the ozil, the active sentry?
Active sentry, that handpiece is having that sensor, so it identifies decrease in IOP in patient's eye at the handpiece level only. So it reacts faster.
Okay, thank you.
Did you compare the epithelial thickness, endothelial thickness, and
no, we have not
connectivity?
compared. It was limitation,
Okay.
sir.
Okay.